So let me share my presentation. Okay, so I hope you can see my PowerPoint.
Yes, sir. Yes, sir.
Right.
It's
Okay.
visible.
Thank you. Yeah. So as I mentioned, I'm going to share the experience how we are doing our teaching of clinical pharmacy in University Science Malaysia. Okay. Just to share where is Malaysia, just in case some of you may not know. Okay, India is here. This is Asia. India is there, down there, and also Malaysia is on the right bottom. Okay, so that is Malaysia, and Malaysia there are two parts actually. One is we call as Peninsular Malaysia, and the other one is uh, Borneo part. Okay, so that's, I know there's Malappuram in Kerala. Okay, I know it's a beautiful city there. Wish to visit you guys one day. And there is Malaysia. Okay, we have two parts of Malaysia with 13 states and one federal, or two federal territories. Okay, just a brief idea how we start pharmacy for undergraduates, or what is the education system if you want to go into pharmacy in Malaysia. Okay, so of course your preschool. Okay, here in Malaysia we assume about 4 to 6 years old is the preschool, and then we have primary school, 7 to 12 years, about 6 years of education, and then we have secondary school, which is 5 years of education, from 13 years until 17 years old. So after that, then they have an exam, and then some of them may drop out, but majority will go for further education. They can either go to high school, they can do A levels, they can do foundation in colleges, or they can also do our own matriculation programs. Okay, so this usually takes about 1 to 2 years. It depends on the program. Some programs are 1 year, some programs are 1.5 years, some programs are 2 years. Okay, after they have completed their high schools, high certificates, then they can apply for pharmacy programs or any other bachelor's programs. Okay, so this we call as undergraduate to get their degree. Okay, so usually they will start their university or college life about 19 to 20 years old, and the degree programs, most of our degree programs are 4 years. Okay, including pharmacy. Okay, the exception is only dentistry and medical, which are 5 years. Okay, the rest are all 4 years, and after 4 years they will get their bachelor of pharmacy. Okay, in USA it's bachelor of pharmacy, honors program. So where is this University Science Malaysia? Okay, just for your knowledge, okay, we are located in Penang. Okay, if you see there, the Penang is at the northern part. Okay, northern western side, west coast of Malaysia. So you can see it has also two parts. One is the island, one is the mainland. Okay, so if I enlarge, then you can see USM is the red dot, is in the Penang Island. Okay, so basically it's in the island. So you know, when you are in an island, usually you can imagine a nice scenery, right? We are near to the beach, so please do come and visit us. Okay, so this is USM, University Science Malaysia, and this is our School of Pharmaceutical Sciences. It's a bit old building. I'm not sure how long. I think Al Shifa is probably a bit new, I assume. School of Pharmaceutical is quite old, so the building is also quite old. Just a brief description of the school. It was established in 1972. So now it's almost 50 years. Next year we are celebrating our 50th year. The first pharmacy school in Malaysia. The second one was University Malaya, which was established in 1992 or 1995. Okay. So after about 20 years, then only our second school of pharmacy started in Malaysia. So that's why USM has produced almost half of the pharmacies in Malaysia are graduates from University Science Malaysia. Okay. So the school offers Bachelor of Pharmacy. We have a Bachelor program. We only have one program, Bachelor of Pharmacy. And Masters of Pharmacy, we have a Master of Pharmacy coursework in clinical pharmacy. It's only 1 year coursework where students are only focused on clinical pharmacy. Okay, and we also have research programs which are Masters of Science and also PhD, doctoral degrees by research. We used to have PhD mixed mode, but due to not very popular in Malaysia, so we had to scrap that program. The degree of Bachelor of Pharmacy is offered through a 4 year program. So the staff that we have now is about 44 full-time lecturers. Okay, as we sometimes we go up to 50. Okay, sometimes it's reduced. So now we are at 44 full-time lecturers. Because in Malaysia we have this staff student ratio for pharmacy programs. Okay, this was decided. This is decided by the Pharmacy Board of Malaysia, which it states that for non-clinical part, for every 10 students, we need one lecturer. Okay, for clinical students, for every 8 students, we need one lecturer. Okay, so that's how we identify how many numbers of lecturers we have and how many numbers of students we can take. We have 44 lecturers, 20 administrative staff, and 42 technical staff members. So basically, our undergraduate students, we have about 120 students per year. So our total students is about 480. So theoretically, we need about 48 lecturers. Okay, but of course, these are full-time lecturers. We also have part-time lecturers and some contract lecturers. So the ratio will be about 1 to 10. And also for clinical lecturers, we have 15 lecturers, so which supports our clinical years. Okay, just a short video to share about our School of Pharmaceutical Sciences. I hope you guys can hear it clearly. I tried just now, it was okay. Let me open again. Okay, I hope you guys can see the screen clearly. Is the screen okay? I don't hear any voice. It means I assume it's okay.
Okay. Yeah, it's okay, sir.
All right, okay. Sorry, let me unmute the video.
Hi, welcome to the School of Pharmaceutical Sciences, University Science Mission. My name is Baharudin Ibrahim. I'm the dean of the school. Through this video, I hope you will learn a little bit more about our school.
top 7 answers on the board. We asked 100 married men.
Okay, so I hope the video is explained clearly about what is School of Pharmacy USM. So as I mentioned earlier, it's the oldest School of Pharmacy in Malaysia. So it is the only school that is recognized by Singapore actually, Pharmacy Board. So we are quite proud to say we are internationally recognized actually, especially in Middle East. Okay, so we have 6 disciplines in the school. Okay, in USM, in Union Science Malaysia, we call the programs or sub-programs as disciplines. Okay, in some other universities, they may call it departments of life sciences, departments of pharmacy practice. Okay, it's just different names, but we started to use this term long time ago, so we just maintain the name. Okay, so we call discipline of pharmacology, discipline of physiology, discipline of pharmaceutical technology, discipline of pharmaceutical chemistry, discipline of social and administrative pharmacy, and discipline of clinical pharmacy. So in USM, one of the unique thing about USM is we don't combine the pharmacy practice. We separate them into one we call as social and administrative pharmacy, another one we call as discipline of clinical pharmacy. But in many parts of Malaysia or all the rest of the Malaysia, most of the time we combine them and call as one discipline of pharmacy practice. But in USM, we separate them into 2 different disciplines. For more, we call more individualized or targeted knowledge or research, where we can be more focused. If it's clinical pharmacy, we focus more on the hospital side and also the community pharmacy. Okay, when it comes to social and administrative pharmacy, we go more to the general public health or public health. Okay. So this is a general how is our curriculum. Okay, it's not a detail, but it's just a general idea how our curriculum is structured. For the first year, of course, I think it will be the same everywhere in the world. We have the basic, the fundamental, the students knowledge that students need for them to learn more detailed parts. So we have basic pharmaceutical chemistry and also physiology and anatomy. So this is where they learn the basics of the drugs, structures, and also the anatomy of the organs cardio, renal, nephro, liver, okay, nerve, neuro, and so on. Then when they move to second year, now they will focus more on the pharmacy related subjects. In first year, there are some basic introduction to pharmacy, some communication skills and so on. But second year, they will be more into pharmacy programs. They will learn more about pharmaceutical technology and also pharmacology. So they will learn how to compound a drug, compounding, how to do a tableting, and then how the kinetic parts, and then in pharmacology, how the mechanisms of drugs, the side effects. Okay, they learn the basics, but not yet application in humans yet. Okay, they just learn the knowledge about the drug itself. Okay, and not about how it's going to affect the humans yet. Not that much yet. They will learn about adverse effects and so on, but not that detail yet. Okay. Then when they go to third year, then we will start to make them understand why they learn separately. Okay, so now we are trying to have courses which have integrated. Okay, for example, we may have an endocrine, for example. So in endocrine, they will learn the physiology about how insulin works, how pancreas works, hormones, and so on. And then they go to learn about the disease, okay, which is clinical pharmacy. They will learn how diabetes is affected, the physiology part of diabetes, the pathophysiology part of diabetes, and so on. And then they will learn about the drugs related to diabetes, all the oral hypoglycemic agents, insulins, and so on, all their chemistry part, their pharmacology part, so on. and then they will learn how the application in clinical pharmacy. Okay, so at this point, the clinical part is quite minor. It's only about 25% of the whole course. Okay, so it's not that detailed yet. We just tell them, for example, metformin for diabetes, gliclazide for diabetes, glibenclamide for diabetes. So we only tell about that, but not to choose based on the patient's individual condition. Okay, we are not going to teach yet. Okay, patient having renal problem or liver problems, or patients are having different drugs. How do you decide the best option? We don't discuss at this point, but we only discuss about the application part. Okay, and then when they go to final year, then we will actually go into clinical. Okay, so in USM, this is very unique to University of Science Malaysia. We don't have it in any other universities in Malaysia. We try to stream them. Okay, so the students, when they are in third year, they can actually decide whether they want to go into clinical pharmacy or industrial pharmacy when they go to fourth year. Okay, so that means even in their third year, they have to start think what are they going to be. Okay, are they going to work in hospital? Are they going to work in community pharmacy, or are they going to work in pharma companies? Okay, we have our local pharma companies and also the international pharma companies. We have manufacturing side and non-manufacturing side as well. So of course the students would have been told this since their second year to prepare themselves to identify where is their strength, whether they are more interested in the pharmaceutical technology aspect, or they are more interested in the clinical pharmacy aspect. So when they go to final year, they will be separated. Okay, but of course, because industrial pharmacy is limited, so we only take about 10% of the students will be allowed to go for industrial pharmacy, because the placements are limited. Okay, but so far majority of our students, from our experience, they still prefer to go to clinical pharmacy, the hospital pharmacy or the community pharmacy. Okay, so the industrial pharmacy I'm not going to explain today, but basically what they do is they go to industry, they do attachment there for about one semester. Okay, so about 4 to 6 months they will be in the industry. They will learn all the things that they should do in the industry. So it's more like a industrial training, okay, for them. For the clinical pharmacy students, they will go to hospital and community pharmacy to learn about how patient care or pharmaceutical care is done in the hospital and community pharmacy setting. So today I'm only going to focus on this clinical pharmacy stream, and not the industrial pharmacy. This is our discipline. We have about 14 or 15 lecturers now, and 3 supporting staff who help us to conduct our clerkship. We have pharmacists and also pharmacy assistants who always help us to conduct our clerkships in the hospitals and also at the university. Okay. So for our program, Bachelor of Pharmacy program, we start the clinical aspect in the third year and final year. So we have 2 years. Okay, if you remember, I showed the curriculum. Okay, third year they have some components of clinical pharmacy, so that's why we still teach clinical pharmacy in the third year. And in final year, okay, those who are going for pharmacy, the clinical pharmacy streaming, they will be learning all the clinical pharmacy clerkships. So I will start with third year first. So in third year, we structured for the students to learn about the pharmacy aspects more. Okay, not much on the medical aspect, but more on the pharmacy aspects. That means the pharmacy, more direct pharmacy related clerkships. Okay, for final year they will go to the ward and so on, so they will have more interactions with the doctors. Okay, for this part they will have more interactions with the pharmacy themselves actually. Okay, so for example, they will have outpatient pharmacy. So to explain what is clerkship means, we call this as clerkship. So it's basically a clinical training. Okay, in medical they may have the short term training in every station. So similarly for pharmacy program, we have this training in every station, which for us we call the term as clerkship. So it's basically actually a practical session of training. So that's what we call as clerkship. So we have for semester 1 in third year, we have outpatient pharmacy, OPD pharmacy. We have inpatient, or sometimes we have satellite pharmacies. And then in the second year, they will focus, in the second semester, they will learn about the aseptic and CDR pharmacy, so TPN and so on, and how to prepare CDR. Not on the oncology aspect much, but more on the training how to reconstitute the drug. Okay, so CDR means is cytotoxic drug reconstitution, and the last one is TDM, therapeutic drug monitoring. So I'll go one by one. What we actually do in outpatient pharmacy. So every lecturer will be in charge of one clerkship for 30 and final year. So the first one is outpatient pharmacy or OPD pharmacy, we call it. So what the students basically learn here is first they will learn how to do a medication counseling in the outpatient setting. Okay, so that means in our hospitals in Malaysia, some of the patients we do bring them into our counseling room and we counsel them. So our students, we train them to do counseling in the outpatient setting. Okay. So we will give them some case scenario and so on. Most of the time we just give them a prescription, which is how the exact prescription the students or the pharmacists in the outpatient department in the hospital will receive. Okay. So in the hospital setting, when patients come to the OPD pharmacy, they'll bring a prescription from the doctor. Okay. In Malaysia, some hospitals they still do manual prescription. That means the patient will bring the prescription to the outpatient pharmacy, and then they will fill the prescription. Okay. In some hospitals, especially in Kuala Lumpur side, a lot of things are already automated or electronic prescribing. So the patients don't need to bring the prescription, and the doctors will just fill in the computer, and then it just goes straight to the pharmacy department. But in USM, we work with the hospital, Penang Hospital, Penang General Hospital, where they still use the older system manual. So these patients will bring the prescription, they'll give to the pharmacy. So the pharmacy will screen first for any errors. Okay, and then if everything is okay, then they will fill the medication and then they will dispense. Okay, and the selected patients, okay, with polypharmacy, with multiple medications, with chronic illness, older age, we may call them for counseling. Okay, so in this clerkship, we do the same thing. We give them a prescription. The students need to screen the prescription, and then they need to call. Usually, the lecturers will act as a patient, and then they'll call them, and then they give counseling. Or sometimes we just ask the students to counsel each other. One will act as a student, patient. One will act as a pharmacy. Then we'll video record them, and then the next day we will discuss with them what are the positive and the things to improve from their counseling. We also do medical device training. So at this year clerkship, we also focus on to train basic use of diabetes monitoring kit, or cholesterol or blood pressure measuring machine, and also inhalers and so on. Okay. We also use OSPI method, okay, objective structured pharmacist examination, where we do one-to-one interview. Okay, we give them some scenarios. We also ask them some questions. Okay, these are more on the basic again, because the students are still in third year, so we assume they don't have much clinical knowledge yet. Okay, this is just to give them some ideas how their final year is going to be, because in final year they will have again OSPI, a separate session which is a full session of clinical, and it will be very detailed. Okay, so at this point we still train them, so they will get familiarized with the objective structured pharmacy examination. It's like OSCE. Okay, OSCE is objective structured clinical examination. So here we call as OSPI because it's objective structured pharmacist examination. So it's slightly different from the clinical examination, because here we give them prescription, we give them a medical device, we give them a patient case, and then students need to solve any pharmaceutical care issues. Okay, so that's the first clerkship. The second one is inpatient or satellite pharmacy. So in this clerkship, what they do is they screen the prescription. So again, we simulate the exact things that will happen in the hospital setting. Okay. The good thing about University of Science Malaysia is we have all these simulated labs in our own School of Pharmacy. Okay, so the students don't need to go to hospital. Okay, because the hospital is quite crowded, and then they will also giving services. So we feel that the students will still be sent there for the actual experience. Okay, but most of the learning actually happen in our university itself, our School of Pharmacy itself. The reason is again, sorry. Okay, no. Okay, so the reason is because our because here we can have more interactions with the students. So when they have any queries, we can actually handle them direct face to face. So we simulate exactly the same what will be happening in the hospital. So in our hospitals, the way inpatient works is, so in the morning, the doctors, the wards will send all the prescriptions to the inpatient pharmacy or satellite pharmacy, and then the pharmacist will screen, and then they will fill the bin. So in Malaysia, we have this trolley, okay, we call medication trolley, where it is actually based on individual patients. Okay, so there will be like a bins, okay, or trolley or locker for individual patient, where we can fill their medication. Okay, we fill based on unit of dose. Okay, that means every day we will separate for every dose. Okay, if patient have to take TDS 3 times daily, then we will fill based on 3 times daily, 8 o'clock, and then 4 o'clock, and then 12 o'clock. Okay, so we have the time back which we fill the medication. We also have unit of use. For certain medication, we use unit of use, for example, paracetamol and so on. So, and then the method is student have to screen the prescription, and then have to fill the bins, and then send to the ward. So they will do the first part, screening the prescription. The students also, for some patients, they may also need to bring the medication, go to the ward and counsel the patient. This is what we call as bedside counseling, okay, or inpatient counseling. Of course, here the lecturers don't want to lie down on the bed, so we let them sit and then being counseled. Okay, but if you can see, we have our own hospital beds actually, where sometimes we also have postgraduate students who may act as patients. So they may lie down there, and then the pharmacist will go and do the counseling. So we do the counseling also, inpatient counseling. And then this is the filling the medication trolley. So we have all the most common medications. So if you can see here, warfarin, loratadine, omeprazole, ranitidine, and so on. So we have all the medications there. So students will, based on the prescription, so they need to calculate the right dose, the right, how many amounts you need to give, half tablet, 1 tablet, 2 tablets, okay, and then they need to pack them in the plastic, and then they have to put in the bin. Okay, so that's what basically they do in the inpatient. So the outpatient pharmacy and inpatient pharmacy or satellite pharmacy, this is for the first semester, third year. So now I go to the second semester in third year. So this is still third year. That means not that much on clinical. Okay, so their knowledge of clinical pharmacy is still limited. Okay, so in second semester, one, they will learn about the aseptic technique, okay, and CDI pharmacy. So this is how to prepare a TPN bag, how to calculate the nutrition, parenteral nutrition for patients, how to reconstitute the drugs, chemo drugs. You need to reconstitute, dilute, and so on, add diluents, and so on. So all these things will be taught in the third year, second semester. Okay. Of course, they also need to learn clean room concept and its maintenance. So in School of Pharmacy USM, we have our own clean room, which is, of course, we only have class C, but we still maintain them. Okay, we clean them regularly. We have all the HEPA filter and so on. We also use laminar flow cabinet. Okay, so the students are taught how to maintain this as well. Okay, so I will just share a video, example of video, how we monitor particle count. Okay, so one of the concept of clean room is their particle count has to have certain numbers. Okay, So for class A, there are certain numbers, class B, certain number, class C, certain numbers, okay? So because ours is class C, so we need to make sure our clean room has that standard. So that means the number of particles should be certain, below certain levels. So how do we monitor them? I just give you one example of the video. Okay, so if you saw the video, it's only showing a particle count. So they are actually measuring at the HEPA filter how much particle count in the room. Okay, so but we also, of course, we also doing how to clean the clean room and so on. Okay, I'm not showing all the videos, but that's one of the things that we do under this clerk sheet. Okay, so this, they will be given the gowns so that they can have that feeling how to actually prepare the sterile solutions. Okay, so this is transferring sterile solution from ampule, vial, and large volume bottle bag using aseptic technique. So we will have some few facilitators to help out. So every student will be trained how to transfer the solutions, sterile solutions in a sterile method, aseptic technique, and then we make sure all the solutions are sterile. And then we also do some assessment one-to-one in the laminar flow cabinet. We see whether they follow all the standard procedure of aseptic technique. And then the last clerk sheet for the third year is called as therapeutic drug monitoring, or TDM. Okay, so in this clerk sheet, okay, previously we teach them how to actually measure the drug levels, okay, for certain drugs. Okay, we used TDS machine last time, okay, but now the machine is spoiled. Okay, so we are not doing this anymore. Okay, but anyway, in Malaysia now, most of the hospitals, the pharmacies don't actually measure the drug level. That component has been given to the pathology unit. Okay, so in Malaysia, the practice is the pharmacies don't handle the blood samples. Okay, the blood samples will be handled by the pathology unit. The pharmacists will get the results, and then they will interpret the results. Okay, then they will say whether they need to reduce the dose, increase the dose, or they need to change the drug or frequency and so on. Okay, so based on the levels. Okay, so the measurements will be done in the pathology unit, and the pharmacist TDM service will provide the recommendation. So how this classship is done is students will go to hospital, because we don't do the measurement in the university, so in the USM. So students have to go to hospital. Okay, they go to the TDM service in Penang General Hospital, and then they will collect the patient's case. They go to the ward, so they will make sure the recommendations and the patient's condition are suitable. Okay, so they have to do how the hospital TDM pharmacists do their service. So they will do the same thing, but they will do the discussions in the USM. Okay, so they go to hospital, collect the case, do everything, and do the recommendation and so on, and then they will come to USM, and then we do have a discussions with our own lecturers or preceptors. So that's about third year. Okay, any questions you guys want to ask, or do you guys need break, or is it okay if I continue? Are you guys okay to continue? Because I'm talking non-stop. If no sound means I assume it's okay. So I'll just continue with the fourth year flagship. Okay. Okay, so as I mentioned earlier, for fourth year, then the student will be more focused on the clinical pharmacy. Okay, so this is clinical pharmacy stream students, not the industrial pharmacy. So that means these students will be exposed a lot on the clinical pharmacy. So that's why you can see the number of clerkships is more compared to third year. So now we have 4 clerkships in first semester and 4 clerkships in second semester. So it's quite a thorough or detailed clerkship activities. So it's quite So it's quite intense clerkship activities. Okay. So in first semester, we have clinical pharmacy 1, where the students will go to general medicine, cardiology unit, and nephrology ward. Okay, these 3 wards. Okay, and then they also go to oncology pharmacy or oncology ward. They do pharmacy MTech. Okay, MTech is actually medication therapy adherence clinic. I'm not sure if this is a general term used in India, but in Malaysia we have a clinic run by pharmacists in the hospital. Okay, which we call it as medication therapy adherence clinics. Although it's called as MTech adherence clinic, but we don't just focus on adherence, but we also focus on the treatment and any pharmaceutical care issues. And then one of the unique things against about USM is we have a clerkship called as pharmacogenomics. Okay, so we also have introduced pharmacogenomics in our undergraduate programs. We assume this technology will be used widely in future, so we already started to teach them in our clerkship. And then in second semester, students will learn clinical pharmacy 2, which is more focused on infectious disease and endocrine wards. And then they will go to nuclear pharmacy. Then they do traditional complementary medicine, and then they do community pharmacy. Okay, so I'll go through this one by one. So for clinical pharmacy 1, which is all the general medicine, cardiology, and nephrology, and clinical pharmacy 2, which are infectious disease and endocrine, and also oncology pharmacy, all the cancer patients. So all these things will be done in our hospital, Penang General Hospital. Of course, USM has their own hospital, which is Hospital University Science Malaysia, but because it's a bit far from our Penang, it's another state, so we prefer to use in Penang General Hospital. Okay, the advantage of going to Penang General Hospital is because this is the biggest hospital in our northern region. Okay, that means all the referral cases will always be referred to Penang General Hospital. So basically, students actually learn a more detailed pharmaceutical care, okay, compared to learning in other hospitals. So that's why for us personally, we prefer the students go to our general hospital. So what they do actually is in these 3 clerkships, okay, first they will do ward rounds with the doctors in the morning. Okay, so they go rounds, and then they will select certain cases with pharmaceutical care issues, and then they will clerk them. Okay, so clerking means they will have to find the right information to solve any pharmaceutical care issues. Once they have done that, then they will go back and they will do some research and then some readings, okay, and then find all the issues, and then they will come to our university, and then in our school we will have case discussion and clinical reasoning. Okay, so we will have a discussions with the group. It's a small group, only about 10 students, and we will try to go through one by one case and see to solve any pharmaceutical care issues. And then individually, the students also need to present their case. Okay, this is also to improve their communication skills, to build their confidence in presenting a case to all the lecturers. Okay, so those are the ward pharmacy clerkships. And then the second one is MTech. So as I explained earlier, this medication therapy adherence clinic. So of course, in the general hospital, we have Respi, MTech, warfarin, MTech. Okay, yeah, these are the 2 main MTech. Okay, but in USM, we focus more on the warfarin. It's just for introduction to the pharmacies, to the students. So we give a scenario. Okay, if patients come to the warfarin clinic, okay, what will happen? And then the students have to find some information. So we do more on the OSPI style. So we do one-to-one discussion with the students. Okay, we give a case, ask them to solve the problem, and then the lecturers again will act as a patient, and then the students as a pharmacist in charge of MTech, they need to counsel the patients. And we also do case discussion and clinical reasoning for individual case. That's MTech. And then the last one for the first semester, 4th year or final year, okay, we do pharmacogenomics clerkship. So in this clerkship, what the students do is they take their own samples and then determine a treatment. So we rotate the drugs. Okay, previously we did clopidogrel and then we did warfarin. Okay, different drugs. So we will prepare the materials based on the drug that we are going to test for. Okay, so for example, if you are testing for warfarin, then we look at CYP2C9 gene only. Okay, we don't look at many genes because of course the cost aspect. For like clopidogrel, we look at CYP2C19. Okay, we measure whether they are wild type or they are variant type. Okay, star 1, star 2, star 3. Okay, different types. So what they do is students will take, we only take their buccal swab. We don't need blood sample. We just need buccal swab. That is sufficient for pharmacogenomic testing. So every student will have to do this. And then they need to process the samples. They need to extract the DNA out. They need to lyse the cells, extract the DNA out, and then they need to amplify the DNA. So the students will run the PCR, polymerase chain reaction. So they will extract and then they put there, and then they also need to find the right gene. Okay, so for this we use RFLP technique, reverse polymerase reaction. Okay, reverse fragmented length polymorphism. Sorry. So using that technique, we can use certain enzyme to cut the certain gene and amplify them. So we know what genes they have, and then we do like gel electrophoresis to identify what DNA they have. So these are samples, and then students run using this PCR. Okay, we have multi-block PCR actually in our school, so they can run many samples in one time. So at the end, after they run gel electrophoresis, then we look at under the UV, and you can see the band. Okay, whether they are star 1, they are star 2, or they are heterogeneous or homogeneous. Okay, so based on this result, the students need to interpret. So again, we will ask them, so for yourself, do you think it's good to give warfarin or clopidogrel, or do you think you want to reduce the dose, increase the dose, or do you think you want to substitute to another drug? So these are all based on evidence from previous research, which have shown for certain types of gene, you may need to change the dose or change the drug. Okay, so that is first semester, final year. Okay, so now I'm going to second semester, final year or fourth year students. Okay, so in here, first classship is we call as nuclear pharmacy. We also introduce nuclear pharmacy because in Malaysia we also have nuclear pharmacy services in hospitals. So we want to introduce them what is these services. Okay, so in our own university, okay, we have a center we call as Advanced Medical and Dental Institute. So in this place, we have a service, we provide service called as known as nuclear pharmacy. Okay, so these are our pharmacies, Mr. Ikwan. So he's actually demonstrating on preparation of radiopharmaceuticals. So he's showing how to prepare the radiopharmaceuticals or radio materials products. And then he will do the case discussion and clinical reasoning with the students, okay, why they are doing this, how they are doing this, and so on. Okay, and then the second clerkship, the third clerkship is TCM, traditional and complementary medicine. So we also do this because, again, we always envision what is the future pharmacy services will be provided in Malaysia. Okay, in Malaysian setting, and in some of the hospitals in Malaysia, we have TCM service, traditional and complementary medicine services. Okay, so because of that, we assume some of our students may go there. So, and of course, even if you are working in community pharmacy, you may need to have knowledge on TCM products. A lot of our community pharmacies are selling supplements and herbal medicines. So it's good for students to learn about TCM. So again, in our own university, we have this center, again, the same one, MD, Advanced Medical and Dental Institute. So in this institute, we have a unit called as integrative medicine. Okay, so in this unit, they actually teach them how to use complementary medicines and complementary and alternative medicines in treating diseases. So the students will go there, they have their own wards as well, and do the attachments and learn how to use the complementary and alternative medicine. Okay. Besides that, we also send the students to our hospital. So this is just next to our AMDI unit, AMDI Institute. It's known as Hospital Kepala Batas. So in this hospital, they have their own, okay, of course it's in Malay, Unit Perubatan Tradition and Complementary. So basically it's a tradition and complementary medicine unit. Okay, so TCM unit. So students also go there and see how is the real life practice of TCM in the hospital. And then they will come back to USM, and then they will discuss with our lecturers and preceptors what they have learned, and also we will give some cases for them to have the discussions. So last but not least, okay, we also expose the students to community pharmacy. So remember the clinical pharmacy for us in Malaysia, we go to hospital pharmacy or community pharmacy. So that's why we also focus on community pharmacy. In fact, our new curriculum, we already started to introduce a third streaming, which is community pharmacy. That means they have hospital pharmacy, they have industrial pharmacy. We are also now introducing community pharmacy, so students can have industrial training in the community pharmacy, okay, for about 4 to 6 months. So they will be more experts in the community pharmacy settings, okay. So they do the attachment. This is our own community pharmacy. It looks nice because it's under USM, okay. So it's very huge, with a lot of space, okay. So we have our own counseling rooms, we have our own seminar rooms. So this is like a ideal pharmacy setting. Of course, it's not practical to do this outside because of the cost, of course, and so on. Okay. But we do this in USM because this is also a training center for our students. Okay. So the students will be taught how to set up a community pharmacy. Okay. About herbal medications, herbal treatments, supplements, and of course the poisons. Okay. We call as poison medications. We also do medical devices training. So in our community pharmacies, we also have sometimes people coming from outside, especially our pensioners. Okay, the pensioners from the USM itself, our old staff who come back to get treatments from the USM. So we also do some measurements, health screening for them. This is actually a bone density densometer to measure the bone density. So we also teach the student how to measure all these things in, again, real life setting in real patients. Of course, in Malaysia, in community pharmacy, we can also do blood glucose measurement. So we also teach them how to do this blood glucose measurement, and also blood pressure monitoring. We also teach them how to monitor the blood pressure. I'll just share a short video, the activities that we do. Okay, this one has no sound, so don't worry if there's no sound. Okay, this is just a short video showing in community pharmacy how we train them using the medical devices. So this is a bone body weight measurement, body fat measurement, diabetes measurement, blood pressure measurement. Okay, okay, it's just repeating. So these are some of the measurements that students learn to do in our community pharmacy. Okay, so basically those are the things that we teach our students in the third year and final year. Okay, the clerkships that I focus. We also have MPharm, Master of Clinical Pharmacy, which I'm not sharing today because then it will be too much. But in Master of Pharmacy, Clinical Pharmacy, it's a coursework program, it's a 1-year program. Again, we teach them more on the hospital side only. Okay, not in community, not industry, just focus on hospital pharmacy. So we go individual system, okay, cardiology, respiratory, nephrology, endocrine. We go individual system and we teach them in detail how to solve pharmaceutical care issues in this group of patients. Okay. So I think that's all what I'm going to share with you guys about our clinical pharmacy. The last video is just to share how I think the whole world has affected by this COVID, I think. And of course, you know, teaching clinical students, medical students, pharmacy students, these students need to go to the hospitals to learn. Okay, but unfortunately, when this COVID happened, we had to do a lot of things online. So we tried to adopt and adapt a new norm. I think new normal. Even in our teachings and trainings, it's not the best method, but with this situation, we tried our best. Okay, so just to share some videos of how the changes happened from before and after the COVID, uh, just for a sharing session. Okay, so I'll share the video with you guys.
Because I'm happy alone if you feel like a room without a roof.
Okay, so that's a short video how we have changed from being happy meeting. Okay, we call our school of pharmacy as family. We always feel we are part of a family. We used to have a lot of fun. Okay, but then due to this COVID, we could not meet. I think it has been quite some time. We actually met everyone face to face, almost a year plus. I think when we start to have back the normal life, then cases start to increase again, and we have to go back to limiting our interactions. So we hope everything will be back to normal, so we can start our teaching and learning activities again, and of course our social activities. Just to share, we also have a lot of community services. We go to our App Origin community. We call as Orang Asli. We go to hospitals where we provide our services to general public. Okay, so all those things have been stopped for the last 1.5 years now. And of course, we don't hope those things will return until end of the year. So hopefully next year we can start back our routine. So I hope everyone will be safe and back to normal. Okay, so this is our whole big group of pharmacy, including our alumni. So we would like to thank everyone for contributing to our School of Pharmacy USM. Okay, with that, I would like to thank you, and